Hello, today's video is entitled God's Battle Plan for Women's Health. At every phase of life, it's crucial for women to stay informed about their current health status and to take proactive steps for wellness and her vitality. Today's video is the ninth in a series of God's Battle Plan series. So God's Battle Plan for Women's Health. Menstrual health or menstrual disorders are common gynecological problems, a lot of women face, and it affects their activities of daily living, their productivity, and obviously their health. We'll be looking at three types of menstrual disorders. Dysmenorrhea means painful periods, premenstrual syndrome, and menorrhagia means excessive bleeding with periods. Dysmenorrhea definition means painful menstrual cramps. Okay, so you have very painful periods. Types: primary, it means there's no underlying disease like polycystic ovaries, adenomyosis, fibroids. Secondary is linked to a condition, okay, like endometriosis, fibroids. Obviously, you would treat them differently. Symptoms includes pelvic pain, backache, nausea, and fatigue. Okay, for the primary one where there's no underlying disease, conditions, it's due to excessive prostaglandin. Okay, so you get a very strong uterine contraction, and leads to a cramp. So that's why you get painful periods. Okay, the management of dysmenorrhea. History, a pelvic examination to rule out any any conditions, and ultrasound if you suspect there is a underlying condition like endometriosis, fibroids. Treatment. Okay, for primary dysmenorrhea, we use non-steroidal anti-inflammatory like naproxen. It's best to take it 1 to 2 days before the onset of menstrual bleeding, as to prevent the prostaglandin from causing the uterine contraction that leads to the painful periods. Hormonal contraceptives to regulate the hormones. Lifestyle, heat therapy, just heat pads, exercise, stress reduction. Premenstrual syndrome is another menstrual disorders. It's a combination of physical and emotional symptoms such as mood swings, tender breasts, fatigue, occurring 1 to 2 weeks before menstruation due to hormonal fluctuations. Premenstrual syndrome, by definition, it's involved physical, emotional, behavioral symptoms before menstruation. Prevalence, 48% globally, and 20% of them are quite severe. Symptoms, physical bloating, breast tenderness, headaches. Psychological symptoms includes irritability, mood swings, and anxiety. And the severe form is called premenstrual dysphoric disorder. So it's much more severe. Management of premenstrual syndrome. First, look at the causes of hormonal fluctuations, serotonin imbalance, and lifestyle factors. So treatment includes lifestyle, exercise, sleep hygiene. That means you have a good sleeping pattern, balanced diet. And for medications, selective serotonin reuptake inhibitor. These are used as an antidepressant. Hormonal contraceptives to balance the hormones. Non-steroidal anti-inflammatories, and cognitive behavior therapy for stress management. The third menstrual disorder, menorrhagia, is defined as heavy and prolonged bleeding. That means more than 7 days. Normally it's like about 3-4 days, but more than 7 days, and large bleeding, more than 80 mils. You can see it in your sanitary pad, and you get large blood clots. Other symptoms include anemia and backache, fatigue, because your red blood cell count drops. And prevalence, 27 to 54% of menstruating individuals. Okay, the causes and diagnosis of menorrhagia or excessive menstrual bleed. Uh, Hormonal imbalances due to polycystic ovaries, thyroid disease, uterine pathology. You could have fibroids or polyps, or bleeding disorders. That means that you're not producing blood clotting factors. That could be a problem. Or medications. Maybe you're on anticoagulants, or you have some intrauterine devices inside, like for pregnancy prevention. Diagnosis, history, pelvic examination, and ultrasound. The blood test to make sure you don't have any bleeding disorders, any like von Willebrand's disease. Biopsy, maybe there's a lesion there, there's a polyp there. Okay, management of menorrhagia, non-steroidal anti-inflammatories. You reduce the prostaglandin levels that cause very strong uterine contraction. So when you reduce it, theoretically, less contraction, less powerful, your menstrual blood loss will be less. Tranexamic acid is an anti-fibrinolytic, right? Okay, fibrin is important for blood clotting, so that will stabilize your blood clotting profile to help reduce the menorrhagia. Hormonal therapy. Hormonal imbalance can lead to menorrhagia. Probably you are producing more estrogen compared to progesterone, so it leads to an imbalance and excessive menstrual bleed. So hormonal therapy is just to stabilize, like the birth control pill. You take birth control pill to stabilize your hormonal levels, so it can help reduce your menstrual bleed. Iron supplements, it's important because you'll be anemic. Or you can put an intrauterine device with levonorgestrel. It's a progesterone, okay, synthetic. That will help reduce the endometrial lining and thereby help reduce the amount of menstrual flow. Surgical DNC, dilatation and curettage. You enlarge the cervix, you dilate and you curettage. It's a diagnostic tool. Whether there's a lesion, any cancer, okay. Hysteroscopy, you put a tube in it's a diagnostic to look for any abnormal findings, polyps, adenomyosis, fibroids. Endometrial ablation, it's not a first option. It's just to thin out the endometrial lining, and thereby you will bleed less during the menstruation. And hysteroscopy is absolutely last option. That's taking out the whole womb. Okay, in comparative summary for managing menstrual disorders, dysmenorrhea, painful cramps, symptoms, pelvic pain, nausea, non-steroidal anti-inflammatories to reduce the prostaglandin levels. Prostaglandin causes your uterus to contract very strongly, so that's why it leads to period pains. Hormones to balance your hormones out. Lifestyle, okay, exercise, stress management, heat pads, premenstrual syndromes, okay, the luteal phase symptoms, okay, luteal phase, mood swings, bloating. So what can you treat with? Lifestyle changes, serotonin reuptake inhibitors, that's used for anxiety disorders and used for depression. Cognitive behavior therapy to deal with the emotional aspects of premenstrual syndrome. Menorrhagia, heavy bleeding, defined as more than 7 days. Clots, and anemic. So treatment I just mentioned, non-steroidal anti-inflammatories, tranexamic acid, maybe a bit of surgery, depending on the condition and the patient. So in conclusion, dysmenorrhea, premenstrual syndrome, and menorrhagia are common but manageable. Early recognition improves the quality of life, okay, which is what we want for all our patients, and encourage awareness and medical consultations for persistent symptoms. Okay, menopause. Every woman will come to a point where she has to decide how to deal with her menopausal symptoms and its subsequent problems. I've roughly touched on it during my presentation on God's Battle Plan for osteoporosis. Okay, of course, menopausal isn't just about your bones. It's about the whole body. It's about your heart. It's about managing your emotions, right? Okay, and your well-being. So these are the stages. Okay, menopause, roughly average age 50. So this is called a climacteric. Okay, but say few years before and few years after your actual periods, your last period. Okay, perimenopausal, here's perimenopausal. Menopausal transition, about 40, 45 to 50. So premenopause, postmenopause. Climacteric physical changes, anatomical sites, and average age of onset. Okay, skin changes. Okay, you'll be dry, your collagen level will go down. That means your skin will be thin. You get wrinkles. Okay, it's in your first few years of menopause, you lose about 30% of your collagen, your bone mass, hair distribution because of estrogen drop. Your testosterone is more powering. Maybe you get some facial hair. I mean, the hair distribution will change. And a few years down, 4 or 5 years down the road, osteoporosis sets in. Hot flushes, it's around the perimenopausal time. Cardiovascular disease will kick in, okay, once you're about 60 onwards. Cardiovascular is predominantly found in male, but once you are postmenopausal, the incidence in women of cardiovascular disease will catch up to that of men. Atrophy of the breasts, as well as your urogenital organs, your bladder lining, your uterus, they will shrink, okay? And women are living longer. You see, like in the 1850s, 1900s, and life expectancy was below 50, but now you're looking at about 80, 90. So dealing with menopause is really a huge socio-economic concern, as well at the country level, at the national level, but also in individual. It can be managed properly. It will improve quality of life. Hormone therapy, most effective for hot flushes, okay, night sweats, 85 to 90% reduction, okay, in clinical trials. Recommended for a woman who's under 60, age 60, and within 10 years of the onset of your menopause. So provided they have low cardiovascular and cancer risk, and they don't have like a tendency for blood clots, okay. Some people will prefer, instead of oral hormones, they can use transdermal estrogen patches, gels, rings, okay, because it lowers the risk of blood clots compared to oral forms. Vaginal estrogen, local therapy, is safe for almost all women, especially for genitourinary syndrome of menopause. So it can be local or it can be oral. Okay, the primary aim of hormone replacement therapy is to improve the physical and psychological well-being of women suffering from climacteric symptoms, and to improve their quality of life. But not every woman is suitable for hormone replacement therapy, so you have to discuss this with your doctor. I mean, you have certain cancers like bowel, breast cancer. You may not want to go on HRT. You have a history of blood clots. That's also why you may not want to go the HRT route. Okay, for those women where HRT is not suitable, there are non-hormonal options. SSRIs, okay, serotonin reuptake inhibitors, or serotonin norepinephrine reuptake inhibitors like paroxetine, venlafaxine. Okay, they reduce vasomotor symptoms like hot flushes by about 40 to 60%. Okay, not as good as HRT, hormone replacement therapy, and it's obviously a second-line use. Fazolinetant, okay, it's a new class of drugs. It's an NK3R antagonist. It's approved by the FDA in 2023. Reduces hot flushes by about 50 to 65%. Okay, and it's hormone-free. And there's another one which was approved by FDA in 2025. It's called linzanetone, and often shows superior benefits in improving sleep quality and acts faster than the fezolinetant, and is a dual NK1 NK3 inhibitor, unlike fezolinetant, which is only an NK3 inhibit, or only works on the NK3R receptor. Other agents like gabapentin is used for seizures. It's also found to be effective in dealing with vasomotor symptoms in menopause. Clonidine is also used, can be used as antihypertensive. Phytoestrogens, you can get bioidentical hormones from certain doctors, made from soy, made from yam, okay, instead of being synthetic. Testosterone for libido, because with menopause your libido may go down. Testosterone is a hormone that actually enhances libido in women. So just to note, SSRI and SNRI, selective serotonin reuptake, and serotonin norepinephrine reuptake inhibitors, they are actually used for anxiety disorders and depression. But paroxetine is also approved secondary use for vasomotor symptoms in menopausal women. Okay, fezolinetant is an NK3R antagonist. It's FDA approved since 2023. It's a neurokinin 3 receptor antagonist. It's a new class of non-hormonal medications to treat moderate to severe vasomotor symptoms like hot flushes and night sweats of menopause. They work by inhibiting neurokinin B in the brain's hypothalamus, balancing thermoregulatory pathways without using hormones. What happens is that when you have menopause, the estrogen level drops, then your thermoreceptors, that means they sense whether your body is too hot or too cold. But here, once the estrogen depletes, even at your 37 degrees body temperature, say, oh, it's too hot, it's too hot. That's why it causes your blood vessels to dilate, leading to vasomotor symptoms, right? And sweating to try to cool you down. Okay, even though when your actually body temperature is normal. So the temperature setting in the brain has gone haywire with the estrogen depression. So obviously HRT is a treatment for such a problem, but this is an alternative.
Hot flashes during menopause? You're not alone, and today we're exploring a new non-hormonal option that may help, Veozah, also known as fezolinetant. Veozah is the first FDA-approved non-hormonal treatment specifically developed to reduce moderate to severe vasomotor symptoms, what we often call hot flashes, associated with menopause. Instead of using estrogen, Veozah targets a brain pathway called the neurokinin B, NKB receptor, which plays a role in the brain's temperature regulation. Veozah may be especially helpful for women who can't, or choose not to, use hormone therapy. That includes women with a history of breast cancer, clotting disorders, or simply those looking for a non-estrogen option. The recommended dose is 45 milligrams taken once a day, with or without food. Just one pill taken around the same time daily, preferably in the evening. Always follow your healthcare provider's guidance and let them know about any other medications you're on. In clinical trials, many women experienced a significant drop in the number and intensity of hot flashes within just a few weeks. That means better sleep, more comfort during the day, and a return to feeling more like yourself. As with any medication, side effects can happen. The most common include headache, stomach pain, diarrhea, and trouble sleeping. Veozah is also processed through the liver, so your doctor may do blood tests before and during treatment to monitor liver function. Veozah isn't right for everyone. It's not approved for use in people with severe liver disease, and it's not a fit for those still having menstrual cycles or for pregnant women. Talk with your healthcare provider to see if Veozah could be a good option for your unique symptoms and health history. Menopause is natural, but suffering through hot flashes doesn't have to be. Veozah brings a new, hormone-free option to the table for women looking for relief. I'm Emily Carter, and this is RX Explained. Don't forget to like, subscribe.
Okay, lifestyle adjustments. Regular exercise is important. Don't smoke. Avoid excessive alcohol. Maintain a healthy diet. Avoid excessive weight gain or weight loss. So enjoy life to the fullest. Okay, you've probably worked very hard during your life. Relevance for Malaysia. For women in Malaysia, where awareness and structured menopause programs are still developing, the global trend towards multidisciplinary care and precision pharmacology highlights the importance of early consultation with gynecologists or endocrinologists, considering transdermal hormone therapy for safer systemic therapy, exploring non-hormonal agents if hormone therapy is contraindicated. I mean, history of, you had breast cancer before, other cancers, blood clots, integrating lifestyle and public approaches to reduce cardiovascular and osteoporosis risk. Okay, I have two other videos, God's Battle Plan for cardiovascular disease and osteoporosis. You can go back and look at them. Okay, comparisons of key therapies. Hormone therapy, effectiveness 70 to 90%, vasomotor symptoms reduction, it protects your bones, okay? Small risk of breast cancer and venous thromboembolism, okay? Blood clots in your legs. Best candidates, women below 60 and less than 10 years after menopause, and those with low risk profile. Okay, these antidepressants, anti-anxiety drugs, SSRIs, SNRIs, 40 to 60% reduction in the vasomotor symptoms like hot flushes, etc. Side effects is that they cause nausea, sexual dysfunction. Best candidates, women contraindicated for hormone therapy. Fezolinetant, 50 to 60% reduction in your vasomotor symptoms, hot flushes, night sweats, okay? Limited long-term data because they are new, okay? And best candidates, women avoiding hormones, and the alizanitane, okay? Similar, significant VMS reduction, but over and above the fezolinetant, it supposedly has better sleep improvement benefits. Okay, women with sleep and vasomotor symptoms are best candidates. Lifestyle changes, okay, obviously important, but you need a lot of discipline. Okay, so every woman should have some lifestyle changes as you enter menopause. Okay, urinary tract infections are very common, more common in women than men. UTI is an infection anywhere in the urinary tract, the kidneys, the ureters, the bladder, or the urethra. Okay, urinary tract infections. Usually a UTI is caused by a bacteria that can also live in the digestive tract, in the vagina or around the urethra, which is at the entrance of the urinary tract. It's more common in women. Women get UTIs up to 30 times more often than men do because of the shorter urethra. Okay, men has a longer urethra because for obvious reasons. Symptoms: burning feeling when you urinate, pain in your back or lower abdomen, frequent or intense urge to urinate, even when you have little urine to pass. Okay, cloudy, dark, bloody, or unusual smelling urine. I mean, usually you can smell it. Okay, fever or chills. Once it's determined that your symptoms have been caused by an infection, your doctor will prescribe an antibiotic. Antibiotics can kill the bacteria causing the infection. The antibiotic prescribed will depend on the type of bacteria found. I mean, the doctor may start you on an antibiotic, and if they found that the bacteria is not sensitive to the antibiotic, the doctor may change the antibiotic, okay, once the cultures are out. Prevention. Drink lots of fluid to flush the bacteria from your system. Try for 6 to 8 glasses of water a day. Drink cranberry juice or take vitamin C. Both increases the acidity of your urine, so your bacteria can't grow easily. Cranberry juice also make your bladder more slippery, so bacteria can't stick to it. Urinate frequently and go when you feel the urge. And urinate shortly after sexual intercourse, okay? Because intercourse may introduce bacteria into your urethra. Okay, sexual health for women. Okay, God's battle plan for women's. God's design for sexual health. Sexual health is part of God's good and intentional design. Okay, the body is beautifully, wonderfully, fearfully made. Okay. Sexual well-being reflects physical, emotional, and spiritual harmony. Understanding sexual health across life stages is important. Puberty and early womanhood, the reproductive years, your perimenopause and menopause. So women go through different stages. They have different needs, health needs, support, and then later in life. Okay, so each stage has unique changes, challenges, and needs. Common sexual health challenges in women: hormonal imbalances, pain or discomfort during intimacy, low libido or sexual dysfunction, vaginal dryness or infections, emotional wounds, stress or past trauma that obviously will affect your sexual mindset. Enemies of sexual well-being: lack of knowledge or misinformation, hormonal disruption and chronic issues. Okay, as you enter menopause, obviously, your organs is going to shrink, the lining, the sensitivity of the organs, of the sexual organs are impacted. Shame, guilt, or silence around sexual health. Obviously, your libido may be down. The ways to treat it, like hormone therapy or testosterone boost, may enhance your libido. Lifestyle factors such as stress, fatigue, and poor nutrition are enemies of sexual well-being. Okay, and untreated medical conditions. Okay, could be your heart, could be anxiety, could be trauma from the past. Okay, and all these, if untreated, will lead to intimacy problems. God's weapon for victory: knowledge, understanding the body's and recognizing the changes early, because the body will transition from your puberty to the reproductive years to perimenopause, menopause. Okay, the needs, the different kind of body changes will occur, so which you have to address. Healthy lifestyle, nutrition, exercise, and rest is paramount throughout her life. Medical wisdom, appropriate treatment, and professional care. So early consultation with your doctors at each stage of your life. Emotional healing, addressing fear, anxiety, and past hurts. Obviously, past hurt, past trauma, failed relationships, unfaithfulness from the male part. Obviously, these have a lot of traumas that they may still be harboring and inhibiting you from going on to have an intimate relationship with a new guy. Faith and prayer, trusting God through every season. Practical strategies for sexual health, regular health screening and gynecological care, make sure the organs are healthy. Open communication with spouse and healthcare providers. Okay, that's very paramount. Maintaining intimacy beyond intercourse is obviously not just sexual, it's also like communication, emotional support. Okay, this will eventually help in the relationship and intimacy. Supportive supplements or therapies when appropriate. We mentioned some. Stress management and mental well-being. The mental is the brain is the biggest sex organ actually. Huh? Restoration and hope. Sexual health challenges are not a failure. Okay, I mean you have to face it in each phase of your life, especially coming to later years in your life. Healing can be progressive and holistic. God desires wholeness, joy, and intimacy for women. Victory is possible through faith, wisdom, and proper care. Sexual health is not just physical. It is the spiritual stewardship and of the body God has entrusted to every woman. Okay, so take care of it. The whole. Okay, physical therapy. There's something called the O shot for women. The O shot or orgasm shot is a non-surgical, in-office procedure using a woman's own platelet-rich plasma, or you can use secretome or exosome as well, injected to the vagina and clitoral tissue to improve sexual function and rejuvenate the vaginal health. Okay, because as you get older, especially menopausal, your tissues will degenerate, so you'll be less sensitive, okay, to intimacy and all that, right? Your organs. So O shot is something. It is designed to increase sensitivity, enhance libido, boost orgasm intensity, improve lubrication, and treat stress urinary incontinence. Okay, what are the key points with the O shot? Enhances the sexual experience, okay, and by increasing the sensitivity of the clitoris and vagina, leading to stronger or more frequent orgasms. Vaginal rejuvenation. It stimulates the collagen production and cell growth, tightening the vagina and improving natural lubrication. Urinary control. It helps address stress urinary incontinence, okay, which is unintentional urination when coughing or sneezing, by strengthening the tissues. Okay. Rapid results often shows noticeable improvements within days or weeks, with full effects usually appearing within 3 months. I mean, you probably may need more than one O shot, maybe regularly, month 1, month 2, month 3. So consult with your doctor.
For years, men have used Viagra to improve their sex lives.
And now a new procedure promises to do the same for maturing women.
Morning anchor Felicia Rodriguez introduces you to the O shot. Some women say it's like finding hidden pleasure you thought you'd only find in the movies.
Who can forget this memorable scene from When Harry Met Sally?
Yes! Yes! Yes!
Want what she's having? Now there's help for women who struggle in the bedroom.
Man.
Marcia.
Hi,
How
Laura.
are you?
I'm good to see you.
So tell me.
Well, it's been amazing.
64-year-old Marcia Hollander underwent a procedure to help improve her sex life.
I realized that as much as I was turned on, my response and my ability to reach an orgasm had diminished, and a lot because I know of age and hormonal changes.
Dr. Laura Skelshock, a dermatologist in Boca Raton, is one of a handful of doctors across the country who offers the O shot.
The O shot is a procedure where we utilize the body's own regenerative ability to create new tissue.
Here's how it works.
Okay, ready?
I'm ready.
Doctors draw a patient's blood, place it in a special tube, and spin it in a centrifuge.
There's your liquid gold right there.
After a few minutes,
Here's the red blood cells. There's the gel that separates it, and then this is what we're going to inject.
doctors then inject the platelet-rich plasma, known as PRP, back inside the patient.
This is the vagina. This is the front wall.
Okay.
And so this is where we're putting it, right between the vagina and the bladder.
What have the results been like for you?
Oh, like fireworks.
Really?
Like fireworks.
Results may not be immediate. For Marcia, it took about 3 weeks before she noticed a difference.
It has probably enhanced my response and my enjoyment more than I ever enjoyed it as a younger woman.
The results are twofold for Marcia. You see, a side effect of the O shot, it actually improves urinary incontinence or loss of bladder control.
It's totally changed my life. I don't have to worry about embarrassing moments. I don't have to worry about urinary tract infections because of wearing a protecting coating. I am in control.
The O shot costs $1,500, and doctors say the effects last for about a year. Marcia says it's money well spent.
Just added a whole new dimension to my sex life, to
Okay, there's there's O shot. There's also a G shot. Okay, the G shot is a non-surgical, in-office procedure designed to temporarily enhance sexual pleasure by by injecting a hyaluronic acid-based filler into the G-spot area. It increases the size and sensitivity of this zone, typically lasting about 3 to 4 months per treatment. Key aspect of the G-shot. Purpose, the injection aims to amplify the G-spot area located on the anterior vaginal wall, making it more pronounced and sensitive to stimulation, which may lead to easier or more intense orgasms. The procedure, a fast 30-minute office using a local anesthesia. The actual injection takes less than a minute. Candidates, the procedure is generally meant for sexually active women with normal sexual function and who seeks to improve their sexual experiences. So if you're menopausal, it's, down the road, your tissues will degenerate. This is the O shot and G shot are options. Results. In studies, a significant percentage of women reported enhanced sexual arousal, though it is not a cure for sexual dysfunction.
Whether or not you're a believer, we've all heard of the G-spot. The question is, have you heard of the G-shot? What is it? Well, it's sort of like, fillers plumping up the cheeks. Well, you can imagine that's what's happening in a different part of the anatomy.
We do not personally offer the G-shot because it is our understanding and it is clinically proven that the G-spot is a very shady area.
I really think there is something where there probably is a large placebo effect to this. A lot of the women that I've injected, some women come in and say, oh my God, it's the best thing that's ever happened. And I have some women that come in and be like, didn't feel much of a difference. I don't know that there's a lot of stock in it.
There is a G-spot and it really does exist. The G-shot, I think the challenge with it is it's a little bit difficult to inject into that area, and because of its proximity to the urethra, they can have some issues with feeling like they need to urinate all the time.
Many people feel that injection in a particular part in the vaginal vault will add a little bit of volume, add a little bit of a bump, and make activity more pleasurable.
If you've got a burning issue you're too afraid to ask your plastic surgeon, get a hold of me at theplasticsurgerychannel.com. I'll find out. I'm John Hammerly.
Breast cancer. I'm sure many of you have had friends, relatives who had breast cancer before, and can be devastating, and it can even take lives. So God's heart and design. Every woman is fearfully and wonderfully made. Our bodies are valuable and worthy of care. And If you have already got breast cancer, suffering from it, illness is not a punishment, okay? God's love is always there, always unconditional, and always constant. You are accepted, loved, deeply favored, highly favored. Scripture: the Lord is close to the brokenhearted and saves those who are crushed in spirits. Psalms 34 verse 18. Okay, so understanding breast cancer. One of the most common cancers in women, can affect women of all ages. I mean, even men also can get breast cancer, not just women. Every detection saves lives. Knowledge is a form of stewardship. Key message: awareness is not fear, it is wisdom. So that's why you have a lot of breast cancer awareness groups, which is good. Risk factors and warning signs of breast cancer: family history, hormonal and lifestyle factors. You've got hormonal imbalances, age and reproductive history, breast lumps, skin changes, nipple changes, pain. Reminder: know what is normal for your body. Okay, so it's very important to like self-examination monthly. Okay, so any changes, you pick it up fast. Now, the enemy strategy, basically fear, shock. It will paralyze you from taking further action. So denial or delay in seeking help. Because why? That's bad. Because early detection leads to early treatment, leads to better treatment outcomes. Shame or silence about breast health. Misinformation and myths. Truth. Fear is defeated by truth and light, God's truth. God's weapon, knowledge. Okay, for people die for the lack of knowledge. My people die for the lack of knowledge, are destroyed for lack of knowledge. Understanding risk and symptoms, early detection, screening and self-awareness. And I said about early detection is important. Early detection, early treatment, better outcome, better treatment outcome. Trusting healthcare professionals. Maybe, you go for a mammogram, once you're about 45, 50, depends, your breast density. Nutritional, exercise and rest. Faith and prayer. Okay. Trust in the Lord with all your heart and He will make your path straight. So for those who have already got breast cancer and suffering from it, it's not a life sentence. It's not a death sentence. Okay. Practical steps for protection and care. Monthly breast self-examination, that's very, very important. Love your body. Regular clinical checkup and mammograms. Seek medical advice promptly for changes, when you detect some changes. Follow treatment plans faithfully if diagnosed. Accept support, do not walk alone, because it's a mental group support that is needed. Okay. Emotional and spiritual healing. Address the fear, the grief, and uncertainty. Why me kind of thing. Lean on family, community, and faith. Prayer brings peace even in uncertainty, because why you don't know what the outcome of your treatment. God walks with us through every season, right? Just remember that. If you're affected by breast cancer or suffering from it, there's restoration and hope. The diagnosis is not the end of the story. Healing may be physical, yes, treatment, emotional as well, and spiritual, right? God is there. Choose hope. Men and women live fully during and after treatment. Yeah, very complete lives. God brings light even in the darkest valleys. I have come that they may have life and have it to the full. Okay, John 10:10. Cervical cancer is also another common thing that affects women. Cervical cancer is a highly preventable malignancy. Okay, highly preventable malignancy of the cervix, almost entirely caused by persistent human papilloma virus infections. 95% of the cases. It is the fourth most common cancer in women globally, often asymptomatic in early stages. Key prevention includes HPV vaccination and regular screening, a pap smear, okay, HPV test, with treatments, treatments include surgery, radiation, and chemotherapy. Okay, for those who are suffering from already got the cervical cancer. Okay, risk factors for HPV infections. Okay, particularly type 16 and 18. Other factors include a weakened immune system. Yeah, your immune system is not able to fight off the HPV. Smoking, because certain carcinogens in cigarette smoking, can lead to changes in the cervical cells, also the weakened immune system to fight against the HPV infections. Long-term use of oral contraceptives are also associated with a higher risk of cervical cancer, okay, of the HPV infection. Hormonal changes can lead to changes in the cervical cells and also affect how the body responds to HPV infections. Prevention and screening for cervical cancer. Cervical cancer is highly preventable. HPV vaccines, okay, preferably below 15, okay, the boys and girls. Recommended for children to prevent infection, okay. Not only girls, boys, because why? It will help them prevent them from spreading it to their future sex partners, or it could be their girlfriend, their wives, okay. Screening. Regular pap smears and HPV tests can detect precarcinoma cells before they turn into cancer, okay. Treatment of cervical cancer, often based on the stage of the cervical cancer. Surgery to remove the cancer cells or the entire, the whole cervix or the whole womb. Radiation therapy using high energy rays to kill the cancer cells. Chemotherapy, medication to kill cancer cells. Immunotherapy, boosting the body's immune system to fight cancer, such as pembrolizumab.
More than 95% of cervical cancer is due to human papillomavirus, also known as HPV. Hi, I'm Dr. Rachel Clark Sisodia. I'm a gynecologic oncologist on staff at the Massachusetts General Hospital. I'm an associate professor at Harvard Medical School and the senior medical director for Mass General Brigham. And this is Understanding Cervical Cancer. So what is cervical cancer? Well, cervical cancer is a cancer that begins in the cervix, which is at the bottom of the uterus. The cervix sort of behaves as a gatekeeper for when a woman is pregnant and helps hold the baby inside. Cervical cancer is primarily caused by human papillomavirus. One of the first things I always tell my patients is, almost everyone who has ever been sexually active has been exposed to HPV. There's no stigma in it, there's no shame in it, full stop. Once a woman contracts HPV, most women will clear it on their own over time. Some women, for reasons that we don't understand, will continue to be HPV positive, and slowly that makes the cells in the cervix become more and more abnormal. And in a small fraction of women, this will ultimately make a cancer. And that's why we recommend getting pap smears, so that your doctor can continually check you to see if you're HPV positive, and if so, if you've made precancerous cells. It is important to note that some more rare causes of cervical cancer are not caused by HPV, but overwhelmingly the majority are. Anyone with a cervix is at risk for cervical cancer. And one of the most important things that I highlight, particularly to the parents of young girls and children, is that your child doesn't have to be sexually active. Your teenager doesn't have to be sexually active to get HPV, which causes cervical cancer. An unfortunate reality is that 1 out of 4 young girls and women in this country are sexually assaulted or the victim of an unwanted sexual interaction, and they could contract HPV then. Other reasons that someone could get cervical cancer or that increase your likelihood of cervical cancer is if you're immunocompromised or if you're a smoker. Cervical cancer is dangerous because it's sneaky, right? You can't see your cervix. It's really hard to actually even feel your cervix. So you could be developing precancerous cells or even a cancer and not know it's there. So unfortunately, the majority of cervical cancer is asymptomatic, which is what makes it hard to detect if you're not coming in for routine checks. So all of this highlights how important it is to see your physician, your care provider, or your OBGYN for care. But if a patient is going to have symptoms, they would be the following: bleeding after intercourse, painful intercourse, especially if it's new and painful, a sensation of pelvic pressure or fullness or pain, or increased vaginal discharge. When thinking about the treatment for cervical cancer, I often think of it in 3 broad buckets. First, precancers, then early stage cancers, and then more advanced cancers. So for a precancer of the cervix, the good news is that a woman or patient with a precancer of the cervix or a dysplasia can come into the office, and generally we can fix it with an easy in-office procedure that's quick and relatively pain-free. For early stage cancers, generally we can still cure those, but it's important to know that surgery gets pretty aggressive pretty quickly, and that's what's required to cure your cancer. For more advanced cancers, those tend to be harder to cure, and these women are almost always treated with a combination of chemotherapy and radiation. The final thing that I would highlight is that we've made amazing advances in the ability to retain fertility, even if you have cervical cancer. There's many new techniques that we can employ to allow a woman or a patient who's had cervical cancer to be able to retain fertility, be treated for their cervical cancer, and still complete a family if that's what they want. So how do we prevent cervical cancer? Well, there are 2 great ways to prevent cervical cancer. And the good news is we actually cured cervical cancer with a vaccine. Vaccines are 99% effective in preventing cervical cancer. The problem is we've just done a bad job of getting them into all the people who are eligible. Reasons people still get cervical cancer are number 1, that they weren't vaccinated, or number 2, that they weren't able to get routine pap smears and HPV tests. As a gynecologic cancer doctor, I recommend that you get all your children vaccinated for HPV, regardless of sex.
Regardless of sex.
Oftentimes, parents will say to me, well, I have a boy. Should I get my boy vaccinated? Absolutely, you should. Boys should be vaccinated because not only are boys carriers of HPV, which can infect later partners, but boys are also susceptible to penile cancer, which is also caused by HPV. In addition to vaccines, women or patients with a cervix, age 21 or older, should get routine pap smears and HPV tests. So it's worth repeating that the best news about cervical cancer is that we've already cured it. Vaccines are 99% effective. And in a country like the United States, where there's widespread availability of vaccines, I truly believe that no patient ever needs to get cervical cancer again. Thanks for watching. I'm Dr. Rachel Clark-Sisodia.
Okay, final few slides. Woman's beauty. A woman are God's gift to humanity. The beauty of a woman is not in the clothes she wears, the figure that she carries, or the way she combs her hair. The beauty of a woman must be seen from her eyes, because that is the doorway to her heart, the place where love resides. Okay, Audrey Hepburn. Okay, final slides. This is just a joke, this one. Girl at from age 8 to 78. At 8, you take her to bed and tell her a story. When she's 18, you tell her a story and take her to bed. At 28, you don't need to tell her a story to take her to bed. At 38, she tells you a story and then take you to bed. At 48, you tell her a story to avoid going to bed. At 58, you stay in bed to avoid her story. At 68, if you take her to bed, then that will be a story. At 78, end of story. Okay, just a light joke. But in honesty, the best gift you can give to your children is to love your wife. Okay, every woman deserves to be truly loved. Thank you, terima kasih, arigato, merci, gracias, thank you.